When people find out what you do, what's the most common question you are asked?
They ask me if there are anything they can do to make them live longer.
I think everyone's worried about that they may die suddenly, and that's what you get harassed about at parties.
What is the one thing about your specialty that you think people would be surprised to hear?
It's enjoyable, it's rewarding, and perhaps not as difficult as some other specialties.
Once you look at it objectively, you realise that we're really only plumbers to the heart.
A lot of our cardiac patients do go home problem fixed in a much better position.
What drew you into cardiac care?
I initially decided I wanted to do cardiology when I was fascinated with the 12-lead ECG, and that 12 squiggly lines could tell you so much about the heart.
And you can see the result within a year, within a few months, within a few weeks, and sometimes just within a few hours.
People often use the terms heart attack and cardiac arrest. What's the difference?
So a heart attack occurs when there's a blocked heart artery and there's not enough blood supply to the heart muscle.
Cardiac arrest refers to the heart just stop functioning. Most of the time the heart stops functioning because the heart just goes dangerously too fast or completely stops.
Those people are unconscious, they're actually dead, and unless they get cardioverted or a zap or they get a shock with a defibrillator device, they do die.
What's the one piece of advice you would give someone who has chest pain?
Chest pain is the most common cardiovascular symptom, and it is important to take it very seriously.
Chest pain can be a sign that something significant is going on, and you may not get a second warning.
Who is at greatest risk of a cardiac event?
Those with the standard cardiac risk factors.
They include high blood pressure, diabetes, high cholesterol, family history, and smoking.
Despite of this, it's not unusual for us to hear someone that has none of those risk factors have a cardiac event.
I mean, my youngest patient that ever had a heart attack was 38, and they had no risk factors whatsoever. They weren't a smoker, they weren't diabetic, they had no family history, and they had a normal cholesterol.
What is the biggest myth about cardiac care?
I think the biggest myth about cardiac care is around presentation.
No separate case is the same. Everyone is different, and everyone can present to hospital in a different way.
Is there a difference between presentation in men and women when they are having a heart attack?
There is significant difference in the presentation.
Whereas men traditionally present with chest discomfort or chest pressure, women tend to have different symptoms,
such as dizziness or just feeling unwell, nausea, etc.
How do I know when to call 000 for an ambulance?
Well, the answer to that is simple. If you have prolonged or severe chest pain, you should call 000 immediately.
What are the things that people can avoid to lower their risk?
I would suggest that they see their GP regularly and ensure that they've got their risk factors under check so that their blood pressure is at target, their cholesterol profile is at target.
By keeping to an ideal weight, not smoking,
exercising 30 minutes a day, at least 5 days a week at moderate intensity, and also having a well-balanced Mediterranean-based diet, high on chicken and fish, vegetables and fruits.
What's changed in treatment and survival rate in the last 20 years?
I think that we're responding to cardiac emergencies a lot better, a lot more promptly, and that ends up in heart attacks having less consequence on the patient.
The evolution of stents have been able to treat acute heart attacks very efficiently by opening up the artery, usually within 30 minutes of arriving to a hospital.
People are having minimally invasive surgery through the right side of the chest, avoiding stenotomy or a cut through the breastbone.
What has been the most recent advancement in treatment?
There are advancements in medicine, refinement of genetic studies that are floating on to change the way we provide recommendations, and there are a lot of refinements in keyhole procedures.
One of them is called an impeller pump, which is a little pump which is inserted through the artery in the groin into the aorta, and this then pumps blood around your body with a little propeller.
Looking at research that's underway, how do you see treatment could change in the future?
I think what's going to happen in the future is we're going to see more and more minimally invasive techniques.
We've been able to master the aortic valve, and we're getting very good results compared to surgery, but now we're tackling the other valves with similar success, including the mitral valve and the tricuspid valve.
I would imagine that we would have a whole lot more medications, perhaps medications that are even better targeted to the individual patient.
When people pull a muscle during exercise, they often get treatment from a physio. How important is cardiac rehabilitation?
Patients that do cardiac rehabilitation tell us that they feel better in themselves, they feel more confident about what they can do.
It's enabled them to focus on what to look out for in the future, gives them incredible confidence, their mood improves, they improve their strength, their mobility.
Can you die from a broken heart?
There is such a thing, a medical condition called takotsubo.
Which is Japanese for octopus bottle, which is what the heart looks like when someone has a very stressful event.
And we need to take it very seriously because it does present just like a heart attack with either very severe chest pain or breathlessness.
The beauty of it is if you identify it, you get the proper treatment, early treatment, you get very quick recovery in only 2 to 4 weeks' time.
What's the most important thing you want anyone watching this to know?
If you think you're having a heart attack, don't wait. Come to emergency department for proper assessment.
Cardiovascular disease still remains the #1 killer of Australians. So we really do need to listen to our bodies and be aware of any symptoms that could be related to heart disease.
Just get a checkup. It's a simple thing to do. There are many places now around town that are doing health checks, and you might be surprised because they might uncover something.